with that, I'll just move forward. And so this is some recent BEBRF symposiums that have all been received with such great enthusiasm. This program, as well as these other programs, were recorded. So if you want to go back and see these, you can go online and watch them. So for those of you who are from out of town, I want to welcome you to Colorado. Colorado is here, this red state. It's probably more of a purple state, but we are here in the middle of the country, and there are some interesting facts. So one, we are named for the Colorado River, which the Spanish travelers named Rio Colorado, and that's for the reddish, ruddy silt that the river carried from the mountains. That's how we got our name. But we're nicknamed the Centennial State. This is because we became a state in 1876, 100 years following the Declaration of Independence. So easy to remember when we became a state. And some of you may be feeling this, that we are the only state that lies entirely above 1,000 meters. And we are quite high elevation throughout the state. We have the most, what we call 14ers, or mountains above 14,000 feet. So we have 53 of them. You can stay longer and hike, but I just recommend you acclimate to the environment first before you go out and do that. So Colorado, we're known for lots of things. So one of them is our beautiful landscapes. This is the Maroon Bell Mountains just out of Aspen. This is a picture I took just a few days ago during a conference out there for movement disorder neurologists. We have lots of wildlife. This is a moose that I was fortunate enough to see on the bus to the Maroon Bells in Aspen and take a picture of. I'm pretty sure he's real and not mechanical. And we also have a nightlife here, and we have opera, symphony. We have all the major sporting teams, and so a lot of outdoor concerts, things like that. So we really have a lovely place to live. But of course, we're not known for any of that. Now, everyone just thinks about us as the marijuana state. Yeah, we're the first to legalize recreation marijuana, and I think everyone remembers the first one, of course, and so people often ask about that. But I think this is really unfair because, before marijuana, we were heavy beer drinkers, and I think it's lost, but we are the third number of breweries per capita. And if you see this number, we're actually the second most drinkers of beer in this state, at 14.1 gallons per year per capita. People forget about that. So let's go flashback to 1981. Yes, I was alive, and I was 11, and I was very excited because MTV was on, that just came onto television, and so the music television. But there actually was a number of important events going on. Sandra Day OConnor became the first Supreme Court Justice nominee. The remaining 52 prisoners or hostages in Iran were released. And also when Princess Di and Prince Charles were married. So lots of events were going on, but there was also another special event, and that involved Miss Maddie Lou Coster, and she was a blepharospasm patient, and she became an advocate for blepharospasm and blepharospasm patients, and she formed and created the BEBRF, and this is her with a younger Dr. Dankovic at the time, just a few years ago, and he helped found the organization, and the purpose was to undertake, promote, develop, carry on the search for the cause and a cure for the benign essential blepharospasm and other related disorders and infirmities of the facial musculature. And now, flash forward 35 years, this is our current president, at least of today, Ms. Mary Lou Thompson, and this has grown tremendously over this time. Really a phenomenal foundation. There are 4 district directors that help support patient support groups in every state, District of Columbia, and Puerto Rico. But that's not all. It's also 41 countries are represented to the BEBRF. including patients and doctors across the world. And they mail out this quarterly newsletter to patients, families, friends of the foundation, and it really is probably the best newsletter that I've seen from the support group. It's really informative and has just put together really well. But one of the main missions, of course, of the BEBRF is research and helping forward the cause or forward the research to find a cause and treatments for it. And this is a summary table that Dr. Stacy put together for last year's symposium, just showing you the tremendous amount of funding that this organization has done. So since its inception, over the first 30 years that it funded grants, it's over $2 million have been awarded for research. So really an impressive amount. And lots of the manuscripts from those investigators who received research grants, as well as an increase in the interest in publications covering blepharospasm itself. And they received a number of accolades and awards over the time. This is a very recent award that was given by the Dystonia Coalition, being accepted here by Dr. Howlett and Dr. Jankovic. And the inscription says that on behalf of the Dystonia community, we thank you for your tireless efforts in supporting people with blepharospasm and your ongoing commitment to advancing research. Okay, so just to cover the speakers who are going to be here today, I can't tell you are all it's very fortunate to have the A team. This is I couldn't imagine putting together a better set of speakers to come and speak with you about this. These are just the pioneers, the leaders in the field, and so I think you're really in for a treat. So first off, we're going to have Dr. Cynthia Camella, who's a professor at Rush University, and she's going to give an overview of blepharospasm and other neurological eye disorders. We're going to have Dr. Fong, professor at Columbia University, one of the founding members of the BEBRF, and a longtime advocate for dystonia research, who's going to talk about the epidemiology and genetics of blepharospasm. We're going to have Dr. Mark Hallett from the National Institutes of Health, who's my mentor at my fellowship that I did at the NIH, who's also part of the medical advisory board at the BEBRF and has done a lot of research in the field. It's going to talk about pathophysiology of facial dystonias. Then we'll have time to answer some questions and a coffee break. And then following that, we'll come back and I will talk briefly about some imaging research in blepharospasm and some of the imaging research that the BEBRF has funded. And then Dr. Victoria Pellick, who many of you in this audience may know and be being treated by, who is an expert in neuro-ophthalmology and eye disorders, and she's going to talk about the relationship of blepharospasm to other eye conditions such as dry eye. And then Dr. Joe Jankovic, professor chair at the Baylor College of Medicine, is going to, who's also a founding member of the BEBRF and published extensively in the field of dystonia and blepharospasm. He will be talking about the medical and complementary treatment approaches to blepharospasm. And after that, I think you will all be very hungry, and we will break for lunch. And then following lunch, we're going to hear from Dr. Richard Anderson, another expert and well-known oculoplastic surgeon from Utah, who will then give us a talk on the surgical treatments of blepharospasm. So last, I just want to make sure that I acknowledge Linda Peterson, who is an upcoming vice president for the BEBRF, but also our local state coordinator and a local arrangements chair. And she really helped tremendously putting this together. And then Sarah Rogers, who is our at the Movement Disorder Center here at the University of Colorado. She's the coordinator, and she has just worked tirelessly to make sure this day runs smoothly. And just without her, this couldn't have been pulled off like it's been so far. And then Allegan, of course, has helped with a grant to help fund this, which also was essential to make sure that it succeeded. So welcome to all of you. I'm looking forward to today and excited to hear these presentations from these amazing pioneering people who have really dedicated their time and heart and soul to blepharospasm and blepharospasm research. All right, and with that, Dr. Kamala is going to start. Thank you.